So one of the most interesting things you're going to learn about is how to find, evaluate, and treat both muscle tears and ligament tears. This is a very important part of therapy because it's very much underdiagnosed, and learning how to treat torn muscles and torn tendons and ligaments will help you tremendously in working with your patients. So if we're using a low-level laser like a 3 or 4 or 5 watt laser, you can put it on the area and leave it there for a while as it stimulates the connective tissue to regenerate. This, of course, is an abdominal muscle tear, which is very, very common and commonly undiagnosed. Then if we go to a higher power laser, I'll put this one on 7,000 milliwatts just because this is very superficial here. But again, still, when we have a very powerful laser, we want to make sure that we keep it moving. So you keep a hotter laser moving because the longer you leave a laser in a spot, the deeper the photons go. And with these muscle tears, they're extremely superficial. Now, you have been taping this on your own, haven't you, Elizabeth?
Every moment of every day.
Okay. So one thing we do to help the patient understand where the tear is we actually mark it. And you look for what I call the Dent Sign. And if I move my hand along her abdominal wall, I feel a little dent there. So I mark the medial edge. And you see I'm marking where I find the dent. And this will demarcate where the tear is. So this is where it's torn all along these dots. And that shows where the tear was. And we're noticing that there's little areas like right here and right here and right here where it's thickening. It's starting to build little bridges and starting to hold that old tear together. So Elizabeth's skin's getting a little irritated from taping so much, so we're going to use a little bit of skin prep on there. That'll help protect the skin. Then, of course, we'll put some coverall stretch on top of that. And now we're going to put this right over the tear. We go a little bit above it and a little bit below it, and there we go. We've now found the tear, we've diagnosed it, we've lasered it, and we've taped it. This is a muscle tear in the calf muscle, in the gastrocnemius soleus. So I've assessed that, and we're going to put some laser on it. So again, if you have a cooler laser, like 2, 3, 4, 5 watts, you can just put the laser on it and leave it there for a while. There's no need to rush moving this laser around. However, if you have a 7, 8, 9, 10 watt laser, 10,000 milliwatts, you will want to keep it moving because when you're putting out that much power, you don't want to burn the tissue. So use shorter treatment times and you have much more movement with your laser therapy. So we're going to mark this again, so I'll do the same thing. As you noticed, when I have an unstable joint, I stress the joint to test ligament laxity. With muscles, I look for what I call the Dent Sign. And the dent is a tear in the muscle or the fascia that demarcates where the tear has occurred. And I almost always mark this for patients because that way when they go home, they pull the tape off. There is the markings which lets them know exactly where the tear is, and that encourages self-help. So that's where the tear is. Now we're going to put some tape on there. So what we do is we measure the tape, of course, and the coverall stretch tape I will put over the body of the tear. But I want to give it more protection when it's a muscle, so I'll actually use some other tape, like some rock tape or kinesio tape on top of that. So what I'm going to do is I'm going to put a little bit of the coverall stretch here. This is going to go over the body of the tear. And then, because she's a very active person, We also want a bigger piece to cover a bigger portion of the calf muscle. So now we take some of the more kinetic tape and we're going to put it over that so we give more pliability and strength to the muscle belly and part of the tendon. So this is a little longer and that gives her more strength and stability. That's how you tape a muscle tear in the calf.